Good afternoon, everyone. Welcome. I'm Dr. Tina Chopra. I'm the Assistant Dean for Faculty Development and Coaching, also the Chair of ID at Wayne State and a hospital epidemiologist at the Detroit Medical Center. My co-host for today's session is Dr. Basim Dubebo, who's the Vice Dean of Faculty Affairs. I want to thank Kate and Kayla from the Office of Faculty Affairs, our speaker, Dr. Sanjay Gupta, and all of you for attending today's fireside chat. I especially want to thank everyone who took the time to send me questions. We are honored to have with us Dr. Gupta to talk to us about this important topic, echoes of the past, examining re-emerging infections and challenges in immunization. As you all know, our speaker doesn't need any introduction. Dr. Gupta is the award-winning chief medical correspondent for CNN, host of the CNN podcast, Chasing Life. Since 2001, Dr. Gupta has covered some of the most important health stories in the US and around the world. Taking you back to March 2020, Dr. Gupta actually penned an opinion piece announcing the network would refer the novel coronavirus outbreak as a pandemic, which was way ahead of the WHO and CDC. Throughout 2020 and 2021, Dr. Gupta reaffirmed his role as a trusted guide to the viewers worldwide on navigating between facts and fiction surrounding COVID-19 and the pandemic. Dr. Gupta plays an important role in CNN's reporting on health and medical news, both domestically and internationally, and regularly contributes to CNN.com. In addition to his work for CNN, he's a practicing neurosurgeon. He's associate professor of neurosurgery at Emory Hospital and the associate chief of neurosurgery at Grady Memorial Hospital in Atlanta. He serves as a diplomat of the American Board of Neurosurgery, and in 2019, he was elected to the National Academy of Medicine, which is one of the highest honors in medical field. He received his undergraduate degree from University of Michigan and a doctorate of medicine degree also from University of Michigan Medical School. He's also a dad to 3 lovely girls, a husband, a son. And today we welcome you, Dr. Gupta. Thank you for being here.
Oh, it is my honor, Dr. Chopra. Thank you. Please call me Sanjay. It's my honor to be here. And I should point out, you're also friends with my Masi, my mom's youngest sister, and she introduced us. And when she calls, people go running. So delighted to be here.
Your Masi, Padma Auntie, is a favorite of ours, our family, and my daughter is actually learning a new language from her. So I am so happy that she introduced us. So thank you for being here again. And thank you to Padma Auntie as well, if she's watching. Let's begin. I want to take you back to 2018. And that's when you actually wrote an opinion piece and you called it the big one. And you advocated for the development of a new vaccine platform and how we can prepare for it. So tell me what led you to do that?
Yeah, it's really interesting, Dr. Chopra. We had been planning to do a big documentary. This is well before the pandemic, 2018, as you mentioned, in part because of a little bit of a silly reason. And that is that there was this notion out there that every 50 years or so, there is a significant pandemic event. It doesn't make sense. I just want to state that. But in 1918, there had been a very significant pandemic, as we well know. In 1968, there was a very significant pandemic. And we thought, well, 50 years later would be 2018. So we'd been thinking about using that as sort of a time frame to work on a documentary and really to explore what happens if we dealt with pandemic flu again. Where are we in the world in terms of being able to diagnose, to assess, and to treat, or in this case, prevent through vaccines, a significant pandemic? And that's what really prompted that. A lot of the focus was on the fact that our vaccine-making technology at that time was still pretty old. It relies on the use of incubating this virus in eggs, and that can be a slow process, slow to react if you suddenly have a novel virus. And was it time to sort of think about how we modernize vaccines? That was it. Obviously, at that time, we had no knowledge of what was about to happen, frankly, just a few months later in 2019.
It's really, really interesting and fascinating to read that opinion piece of yours because, we knew what happened in 2020. And, let's talk a little bit about the resurgence of infectious diseases. We are seeing a lot of re-emerging infections. We've observed the return of measles, whooping cough recently, and it's no joke. Measles, as you know, and I know, and a lot of us read about the reproduction number. The R naught for measles is anywhere between 12 to 18, which is much higher than flu, for example, which is almost 1.9, and SARS-CoV-2, which is 4. Measles is, as we know, the most contagious infectious diseases. So, we are seeing a decline in childhood vaccination rates. What are your reflections on these re-emerging infections?
Yeah, I mean, this obviously, Dr. Chopra, is a very big topic. We talk about it a lot, and I think there's lots of things that are going on here. I do think and I'm like you. I don't want to be glib about this. I'm not making any jokes. It's no joke. But I think in some ways we do see this regression of our society because of people's desire not to take vaccines, to lose trust, I think, in the overall medical establishment when it comes to these things. And that's too bad. What I would say is this, just to take the conversation a little bit further, is that when you look at people who are quote unquote anti-vaxxers, or let's say vaccine hesitant or vaccine reluctant, I think it's a more heterogeneous mix of people than I think is realized. I think there are some people who are just trying to create trouble, trying to create political division, create chaos. There is a component of that. I do think there's another component of people who very much see themselves not as chaos creators, but more as protectors of the universe, sort of the guardians of the galaxy. They are the ones whose antennas are going to be raised really high, and they're going to try and look for problems that no one else sees. If your antenna's raised really high, you may see issues that don't really exist, but you may also sometimes see issues before everyone else does. And that's how they see themselves to some extent. Regardless, the problem with a lot of these established vaccines, MMR, as you mentioned, is that not only are they safe vaccines, but now you have so many decades of real world data from a very, very diverse population. The planet, people on the planet all over the earth have received these vaccines. So I think the lack of trust is concerning in this regard, because you do see a return of some of these diseases. I don't know how or when that gets better. Frankly, I think even if you go back and look 100 years ago, obviously we didn't have these vaccines then, but even at that time, there was about a 20% of the population, roughly 1/5, who did not want to abide by basic public health practices. And if you look at the percentage of people who are reluctant nowadays, 100 years later, it's about 17 to 24%. It's starting to lead me to believe, Dr. Chopra, that maybe that's just how the world works. That, when you implement new recommendations for the entire population, I think you almost have to predict that about 20%, I'm making the number up a little bit, but just based on history, 20% are going to be reluctant to abide by those things. And I think that's what we're seeing now.
Yeah, you very rightly talk about, the misinformation out there and the spread of this misinformation and social media, the fact that some people who may not be even scientists may have for more than 4 million followers, and that's how people are going to follow them and not follow the real public servants. But regardless, when we look at the data, and we analyze on why people are hesitant to receive the vaccines, for example, even COVID-19 vaccine, people talk about one of the common reasons is lack of trust, right? And you talk about it in your book World War C, which basically it addresses a lot of these myths surrounding COVID-19 vaccine. It provides clarity, which is commendable. But as a society, what proactive steps can we take to enhance vaccination rates overall? Because we are seeing these infections reemerge, and for the world of healthcare, this is a big threat.
Yeah, no, I think there's no doubt. And, I think having reported on infectious disease outbreaks and pandemics for so long, I do think there are a couple of themes that emerge in terms of restoring trust. First of all, I think, you and I are both doctors, and I think you're obviously a very good doctor, and I'm sure your patients listen to you. But there has been an erosion of trust in the mainstream medical establishment. I think you've probably sensed that in other ways. I certainly have seen that in other ways. And, just going back to what I said earlier, that can be for a multitude of different reasons. But I think there's one thing that has stayed relatively consistent. And that is that as much as you might talk about the efficacy of vaccines and say, look, when it comes to COVID-19 vaccines, billions of people have now taken these vaccines. So we have all of this data. It was not just based on the initial rollout, but here's what we've learned since then. Even if you talked about that, even if you rolled up your own arm and took a vaccine in front of people, it'll only go a certain way. For the people who are very, very reluctant, I think what you really find is that people within their community, people who are trusted members of their community. Maybe they're doctors and nurses, maybe they're not. They're just trusted. You have to identify people within communities. I covered the polio outbreaks in Northern Africa. And when they were trying to get people to take an oral vaccine, it's drops on the tongue. It's not a shot even. What you found is that respected community members, sometimes they were people who had some degree of celebrity or notoriety. Sometimes they were people who were very involved in charitable actions within the community. I think you have to identify those folks. I think, again, while it makes me sad to say, I think there has been an increasing distrust of doctors, of the medical establishment. Increasingly, doctors have been seen as arrogant, according to some of the polls that I've seen. So I think that has been part of the problem. When it comes to engendering the trust, identifying the best sort of communicators within certain communities and making those communities as small as possible. It could be your neighborhood. It could be a workplace. It could be whatever. Identifying those people, I think, becomes crucially important.
Yeah, it's very interesting that you mentioned the polio immunization campaign. And as you know, in India, there was a huge polio campaign. And, I was a medical student at that time. And I remember going house to house, in rural areas in India, in Punjab. And we would knock at doors and we would give 2 drops. We would urge people to get two drops. And people would take it, even without having any knowledge about the vaccine or about the disease. They would take it because, again, I think reinforcing what you said, the trust, when they have that basic trust in the person or in the leader who is approaching them, I think it makes a huge difference.
I completely agree. And I think going door to door, letting people see your face, all of that makes a big difference. Look, one thing I'll say, Dr. Chopra, I think we can speak candidly, both as doctors, is that, we are, if you look at medicine overall and healthcare in the United States overall, it's a very expensive industry. We spend more than $4 trillion on healthcare. And the reason I bring that up is I think whenever there is large organizations involved, whenever there's big money involved, that's also going to be a part of the fuel for distrust. Follow the money, people will say. The vaccines are not necessary. People are just trying to make $1 on me, that sort of thing. I'm not agreeing with this. I'm not condoning it, but I'm being realistic about it. I do think that, again, going back to the idea that if you think of healthcare more like a cottage industry, the people who care about me are the people that I live with, people in my community, the people that I work with, the people that I can look in the eye. So just like you're saying, you go door to door as a medical student, that probably made a huge difference.
Yeah, that's very, very interesting. And I think very relevant to our population here in Detroit. And we have a lot of community organizations that Wayne State runs. And we happen to have these mobile clinics that, go door to door since the pandemic, which has made a huge difference. So that's really helpful. I want to go a little bit deeper into the misinformation topic. And and discuss that even in more detail, because what's happening now is that children are being affected. And,
Yeah.
when the children are being affected, their immunization rates are falling. And, we happen to have one of the lowest immunization rates in the nation for children. And, I run this program. It's called a Vaccine Ambassador program, where we train high school students about vaccines, and they go and we do train the trainer sessions, and they go and train others around it. And from that program, which has been running strong for the past 2 years, I've realized that there's such misinformation, even amongst the youth. What do you think? How can we sort of prevent this hesitancy and misinformation to trickle over to childhood vaccinations?
I think we are at a very challenging time, to be completely honest, and exactly how this looks 5 years or 10 years from now, I think is a little bit of an open question. I think anybody who tells you that they know, it would be impossible to sort of predict. When you look at the difference between now and 1918, for example, I think has a lot to do with how people are obtaining their information, and a lot of that on social media. There is no sort of guardrails, or very few guardrails there. I think some of these platforms have tried to do a better job, being clearer about the information they're putting out there, or at least if somebody looks up vaccines and autism, for example, on many platforms, you will get a box that appears. You might get the search that said, "Oh yeah, according to Dr. Andrew Wakefield, vaccines do cause autism." But you will also get a box that is the most relevant current scientific data on that, which does not show any relation at all between vaccines and autism. So, but I think that's, it's a little bit buyer beware when people are going out and seeking information. I do think ultimately that changes. I have 3 teenagers. I have 3 teenage girls, 19, 17, and 15. And it's very interesting the way that they look at social media. I think for us, you talk about people who have 4 million followers, people are looking at them as trusted sources of information. For my kids, I don't really think they believe much of what's on the internet or on social media at all. Good information or bad information. They assume it's all contaminated information. It's all polluted in some way. So they may be entertained by it, but to use it as a trusted source is probably not. So I think social media outreach campaigns, I think, have a limit in terms of what they can actually achieve, because it's all become the Wild West in terms of the information that's out there. So, I think, frankly, it goes back to exactly what you're doing. The eye-to-eye, hands-on approach, which is challenging in healthcare. It costs money, it costs resources. But I think having fairs, vaccine fairs, things like that, when we looked at all the various strategies that were employed during the COVID-19 pandemic, for example, those things went a long way. I live in Atlanta, in underserved areas of Atlanta. They would put on these big vaccine fairs, and they had their highest engagement rate of anything in terms of actually getting through. So human connection. I mean, we live at a time when loneliness and isolation are at all-time highs. Human connection may not only provide a value of actually getting a vaccine to somebody, but actually provide another therapeutic value, which is to address some of the loneliness and isolation as well.
Now, that is great to know, because, this is, that means we are doing something good. And I think this inspires us to continue doing it, and not, sort of feeling dejected that things are not working, because this is the way to go. And I would urge our community partners to continue doing the human connection, the fairs, like you rightly pointed out. This is a nice segue into talking a little bit about your book, where you suggest that while pandemics were traditionally viewed as rare occurrences, happening once in a century, COVID may be seen as an ultimate dress rehearsal, indicating that many of us may experience another pandemic in our lifetimes. So, what are your thoughts on what might come next?
Yeah, for sure. If I can just say one more thing about the previous topic as well. I do think that as doctors, as healthcare professionals, as people who have a role in caring for other human beings, whatever that role may be, I think you have to very much resist the urge to get angry about the people who have not been vaccinated. I understand that there's anger and sometimes frustration and maybe even a desire to vilify people. I would humbly suggest to resist that urge. People may be frightened for all sorts of different reasons. And like I said, it's a heterogeneous group of people who resist vaccines. But, 5 years ago, 10 years ago, the most common, if you had to pick a demographic of people who are most commonly going to resist vaccines, it was mostly young mothers, and mostly more liberal young mothers. And now it is mostly older conservative men. And that is, my point is that it is a proxy issue. People are being used as proxies for a larger sort of issue, usually around politics and money somehow. So resist the urge to get angry at the people who have themselves been subjected to misinformation campaigns. They are being told this information. It's the wrong information, but many of them aren't making it up. So anyways, I just wanted to throw that in there as well.
No, I totally agree. I mean, it's so true that, that patience and staying humble and not being judgmental, this happens every day when we talk to our patients about vaccines in general, whether it is flu, COVID, or even talking to moms to get their children vaccinated. And I agree with you. I mean, they are not making it up. They are hearing it from someone. And that is our opportunity to hear them out calmly in a non-judgmental way, and be patient with them, and maybe give them time to think about what we have to say.
Yes, we're in full agreement on this. I mean, we all went into medicine for a reason, and ultimately, it's not about being right or having the ability to boast or be prideful. It is to take care of our patients, and that can come in all sorts of different forms, as you and I are talking about. With regard to the next pandemic, I am probably like you. I have been keeping a close eye on a few things out there, predominantly H5N1, which is a flu virus that I actually spent time covering in Southeast Asia back about 15 years ago. It's of low risk right now to the general population. But I think in some ways, it's a case study in some of the same mistakes, I think, that we are making now that we did with COVID. And I was thinking about how, I was thinking about our conversation we were going to have and how best to convey this, because I knew you were going to ask me this question. And I think, when we think of medicine, a lot of times we think of taking care of each patient one at a time in front of us. I think to apply that same mentality to public health, I think can be challenging, but necessary. And here's what I mean. With a patient right in front of you, you might obtain certain data from the patient, do certain blood work, do certain tests, to get an idea of what's happening. Right now, that sort of data collection is not really going on at a sufficient level when it comes to something like H5N1. We know that there have been spread of this virus among dairy cattle. We know some 40 different species of mammals have been affected by this. We only know of 3 humans, including one in Michigan, as you may know, who had respiratory symptoms, 2 others who had eye symptoms, conjunctivitis type symptoms, probably from touching a surface and then touching their eyes. What we don't know really is how many more people have been affected, because these are the people who put their hands up and said, yeah, let me get this checked out. A lot of people might have pink eye and never bother to get it checked out, just get some medication on the way home from work. Even the gentleman with respiratory symptoms, it wasn't that severe. All these people cleared pretty easily with antiviral medications. We don't know, are we looking at the tip of the iceberg here with regard to how much H5N1 is spread? Or are we doing a good job of catching things? My guess is it's more tip of the iceberg. And so we didn't do enough testing early on with regard to COVID back in 2020, and that's for all sorts of different reasons. I think we can't make that same mistake again. I think probably all farm workers, but not just farm workers, people who are dealing with these animals, people who are taking these animals to secondary, tertiary locations, even people who are dealing with raw meat and raw milk in other industries unrelated to the farming industry, probably need to start getting tested. And I know this sounds, it might sound ludicrous to people who are listening. Wait, are you just suggesting we all start testing ourselves for flu viruses on a regular basis? Yes. I think it's got to be as easy as brushing your teeth. We got to make it that easy. And we have the technology to do that right now. So I'm worried about H5N1. I think right now it's of low risk. You know the data, I know the data, that in the past, when you've had these spillover events into humans of H5N1, sometimes it's been a disaster. I mean, you talk about 50% mortality rate with that particular virus. I don't say that to scare anybody, but I say that because it should be a clarion call to be prepared. And I think that starts with testing.
Absolutely. And, that leads me to this question. You talk about, we talk about preparation, preparing for the next pandemic. We talk about lessons learned. And there's a lot of articles written about lessons learned, lots of books written about lessons learned. So if at all there is one lesson, and I particularly speak it as an epidemiologist working from Detroit, where we had limited resources for testing. So I find myself in the same position, and you may find some frustration in my voice because why aren't we testing enough for H5N1? Why are we just catching the tip of the iceberg? Why aren't we testing all the farmers? And why isn't there more testing? Whereas we should have learned those lessons from the pandemic.
Yeah, I sense, I feel the same confusion about this as you do. What I will say is if you look at this, and I don't want to be reductionist about this, but if you look at this purely from an economic model, it might start to make a little bit more sense. But I'm not excusing it. But I'm saying, okay, if you look at the chicken industry, for example, this has primarily been in birds, and then you've had spillover into poultry with H5N1. There was a conscious decision made by the U.S. Department of Agriculture many years ago that if there was outbreaks among chickens, that there would be swift action taken. The chickens would be culled, and they would try and really reduce the spread. But in order to do that, you had to compensate farmers for their losses, because those are significant losses. And that's something that's been happening. And I think it's worked reasonably well among the poultry industry. We've not seen this in dairy cattle before, certainly not the way that we're seeing it now. Maybe there was isolated cases here and there, but not this huge number of cattle, big herds, and even across state lines. Not seen that before. Right now, there's not a specific program in place to compensate, first of all, workers who may now, because they test positive, have to take several days off of work. If they don't have compensation for that, they're not incentivized to put their hands up and say this. There's not a compensation if you have to cull or lose a lot of your dairy cattle, which are very expensive. Same thing with milk. There was a desire to get as much milk out there as possible. We're going to pasteurize it, so why worry about that? So I think, in some ways, while it's not a panacea, it's not a cure-all, I think understanding the pain points as to why people would not want to get tested, why they may not put their hand forth, if they're not feeling well, things like that. Some of that is, I think, very predictable. I mean, we see that even before the pandemic with flu. I mean, you may have had people show up even in hospitals who are sick. And you say, why, you're going to get all the other patients sick. Like, what are you doing? But they don't want to miss work. They don't want to see it as a sign of weakness. I can still do it, whatever it may be. The culture around infectious diseases, I think, has to change. I think when you're dealing with something that's highly visible, that's different. With an infectious disease, an invisible virus or something, I think it becomes much more challenging for people to convince them that it's a big deal and that they need to do something about it at the individual level as well as the societal level. I think that the Office of Pandemic Preparedness, which exists now in the White House and is supposed to oversee whatever agencies are involved, so CDC, FDA, USDA, Department of Agriculture, they need to basically aggregate all these folks and say, okay, we know what needs to be done. Dr. Chopra at Wayne State knows what needs to be done. As a beginning point, we need to be testing people. So what are the pain points to make that happen, and how do we address them? It's that important. We spent over $1 trillion dealing with the aftermath and continuing to deal with COVID. It's not over. We could save a lot of that money, just like we do with patients, by preventing disease in the first place. And I think that starts again with testing.
Yeah, the culture around infectious diseases needs to be changed. I will take your quote, and I think this may be your next book that you may want to write. but
No.
Sanjay, tell me a little bit about H5N1. I have been staying up at night thinking about it. Like, I'm imagining that, let's say there is a farm and there is a pig in the farm along with a cow that is sick, and the virus goes to the pig. And as we know, you and I know, pigs are perfect mixing vessels, right? And that's when the worry of getting it from to humans and then human to human transmission, which is a big, as you know, a big danger, to a big threat to all of us. So are we not thinking about it? Is this just me thinking about this whole mixing, or are others thinking about it? What do you think?
I think I mean, you're obviously very you're a leader in this area, so it's you're thinking about this. I do think that there are other people who are thinking about this. I speak to a lot of them. I think when you're an investigative reporter like I am, most of our time, frankly, over 80% of our time is not spent doing anything on TV. It's spent collecting data, collecting news, collecting information. So I spend a lot of time talking to people. And there's organizations like Rick Bright, for example, he used to run Biomedical Advanced Research, BARDA organization, and he's somebody who's now in the private sector talking a lot about this. Michael Osterholm out of Minnesota. There are several people who have big voices who have been really sounding the alarm on this for some time. And I think, it's interesting because in public health and in medicine, you think, well, this is obviously the right answer. This is what should be happening. But I think when you're dealing with people who've been working in these areas for decades, what I've learned from them is that at the end of the day, you want to take the best care you can of your patients. So it's not always about being right. The right answer is that we should be doing more testing, far more testing. But I think it's about trying to do the best job you can for your patients. So I think what you're seeing from people like Rick Bright and Michael Osterholm is this desire to say, okay, how do we make this work? What are some of the other steps that can be taken if we're not getting enough traction with USDA and CDC and they're not communicating? So, for example, one thing you know a lot about, but I think I learned a lot about during the COVID pandemic is wastewater surveillance. So here's an opportunity. It's not as precise, it's not as granular as actually testing somebody one-on-one, but you can start to get an idea, sort of a forecast of what is happening in particular areas. So, and it's pretty good. It's pretty good if you start to see significant H5N1 in wastewater. That might give you a heads up that you're going to start having some problems, and people can use that data to forecast different things and maybe even make recommendations for communities. So it's not an all or nothing sort of scenario, I think, with many of these people who are raising the alarm there. I think the other thing that comes up is we have about 4.8 million, as I'm told, doses of the H5N1 vaccine. And right now, as things stand right now, that appears to be a pretty good match, that vaccine. This virus may continue to change. And as you point out, if it gets into certain mammals like pigs, who are very good at not only having receptors for H5N1, but for other flu viruses as well, other H's and N's, you can get a real mixing bowl within pigs, and something might come out that is particularly problematic for humans. So that's one area that needs to be tested in particular. But I think right now, you may have seen, I think it's in Finland, they've actually preventatively started giving vaccines to people they consider high risk in Finland for H5N1. And I think that that's going to be a topic of discussion, maybe even over the next several weeks at the highest levels of government. Farm workers, people who are involved with the meat and dairy industry in some way. There's probably more than 5 million, but you probably address the 5 million people who are the highest risk and start getting vaccines to them.
Yeah, no, that's very reassuring to know. If that happens, that would be a big step towards the right direction to at least get the high risk people vaccinated. But moving on, let's talk about your discussion when you talked about in your book, you talked about echoes from 9/11 failures. And I promise I didn't pick my topic from reading that. But you talk about parallels with COVID-19 preparedness failure. You highlight the significant role obesity played in COVID-19 morbidity and mortality, and both your books, they delve into remaking metabolism through nutrition and view food as a epigenetic tool. Can you elaborate on this concept for our medical staff, for our medical students here?
Yeah, this is it's a very important topic. I mean, at a sort of broad level, it is worth remembering, just talking about COVID, for example, that going into the pandemic. So even when we were making our original documentary back in 2018 about vaccine technology, we were considered the best prepared country in the world to basically deal with the pandemic. And we know how that turned out. And again, like you, I'm not making jokes here. I'm not trying to be glib. I'm just saying we know how that turned out. We had much higher mortality, obviously a lot of morbidity, and there's lots of reasons for that. But one of them, I think, centers around the point that you're raising, which is sort of how equipped were we as human beings from a physical, personal health standpoint to go into a pandemic? And the answer is not very well equipped. I mean, when you have 40% plus of the nation that is obese, and that ended up being a very significant risk factor for a bad outcome from COVID, that's a problem. Not to mention asthma and diabetes and renal disease, many other things that we have extraordinarily high rates of in the United States. And I think, there's a basic lesson here, Dr. Chopra, which, I've been in some ways for my entire career in medical journalism have been orbiting around this principle, which is that wealth does not equal health. Wealth cannot necessarily buy health. We know people at an individual level who are very wealthy and have terrible health. And we've seen as a country that sometimes the opposite is true. The more money you have, the less health you have. More processed foods, more desire to have a life of convenience. All those things that, you know very well, probably most of the audience knows very well. It's not a surprise. But I think what we saw, when someone is obese, you say, okay, well, look, this is going to be something that's going to set you up for more problems years or decades down the line. You have to get your weight under control. What COVID did in many ways was highly accelerate the time frame by which these issues became problems. Someone who had a mild heart disease suddenly had a much more accelerated problem because of all the inflammation from COVID. Same thing with obesity. So, I do think there were some real lessons in there for the overall health of people. And I saw this primarily more so in the Black community, for example. You saw people who were very concerned about their risk factors for bad outcome and started doing things that they had not thought about or previously done in the years leading up to COVID. So, I think our metabolic health we've always known is important. But I think for a lot of people, prevention in and of itself is a challenging concept. I remember when I was doing some of my early stories, as a reporter, and I remember you would basically be saying, look, you need to eat right, you need to exercise, you need to live a healthy lifestyle, and if you do those things, nothing will happen to you. It's not the most inspiring message, right? Because nothing will happen to me. What does that mean? 30 years from now, 40 years from now, nothing will happen to me. It's very, you got to close the loop for people. So a lot of the messaging I give around prevention is not necessarily, hey, you're doing this to prevent disease decades down the line. A lot of times in the messaging that I give is that you're going to feel better today. You're going to be a better wife. You're going to be a better husband, better son, better daughter, better colleague, better friend today because of the good lifestyle choices you make. You feel better today. It feels good to do good today. And I think that's it's an important message. It's a little bit philosophical. I do think that, there will always be healthy debates about the best way to live a healthy lifestyle. What exactly is the best diet? And I think it's going to be different for different people. We're getting much more granular about that. I think how much activity is the right amount of activity for some, we say 10,000 steps, who knows? Could be 9,000 for somebody, 11,000 for the next person. we use these shotgun approaches, and we will continue to have healthy debates about that. And as we learn more and more about the individual through their genetics, looking at their microbiome, all these different topics, we'll start to be able to tailor the best sort of lifestyles for people. But in the interim, people have got to believe that it's important, that not only will it make me less likely to have a disease decades from now, but that I'll be better today. And I think it's a change in messaging, but I think a really important one.
Very interesting the message that you pointed out, that talking about today, we are not talking about years to come, but talking about today. And I think it's very relevant in the world of infectious diseases. We see cardiologists, we see endocrinologists talking about diet and lifestyle, but since I have gone through the pandemic and seen the data, and we are in Detroit, we have a higher percentage of African American population, and we have the highest prevalence of diabetes and obesity. And we actually published our paper talking about the mortality, in our population. And yes, we have all those risk factors in our population. But as an ID physician, let's say I'm talking to a patient, but in the past we never talked about nutrition. We treated the infection and we moved on. We are consultants. We treated the infection, moved on. But I think it is even more important moving forward that each one of us, whether we are physicians or nurses, any healthcare worker, any contact we have with our patients, we talk about lifestyle. There is this whole American College of Lifestyle Medicine that talks about everything that you have mentioned in your book, and way before the pandemic, which is commendable, to point out the risk factors that we are carrying with us. We are carrying those risk factors for whether it is heart disease or whether it is infection, getting into the ICU from an infection like COVID.
Yeah, look, you are right. I mean, in so many ways, I think our healthcare system has sort of operated like a fireman system, rushing to the scene of the next fire every single time, and not doing enough to prevent the fires. And I think that, again, there's all sorts of reasons for that, as you well know. For a long time, I think the incentive that a doctor would have who is very busy in their practice to spend the extra time, which takes time, to really nutritionally counsel their patients, or maybe even the knowledge that doctors have or don't have around these topics themselves, that has all played a role. One thing I will say, and I will share this with you because I think it's been a little bit of an evolution of my own thinking on this. Many of these patients that we're talking about who deal with obesity and deal with many of these risk factors that we're talking about, it's not always their fault. I just, and I think there's a tendency to say, look, just eat right and exercise. First of all, the cheapest foods are the worst foods in this country. I mean, you can buy a caramelized apple cheaper than you can buy a fresh apple. I saw that in the store the other day. Literally, a candy-covered apple was cheaper than just a fresh apple. How is that? I don't even know how that's possible. But it's because of volume. People wanted the cheaper. They can buy a lot of candied apples, and so they'll charge a lower price. People, it's just crazy. But I think even more than that, physiologically, one thing I've learned as a result of a documentary I'm working on around these GLP medications, glucagon-like peptide medications like Ozempic and Wegovy and Mounjaro. I think for some people, you're obviously a fit person, Dr. Chopra. You eat and you make enough of this GLP hormone, which sends a signal to your brain that you are full, that you are satiated. You don't need to eat anymore. I think just like diabetics, some of them don't make enough insulin or don't make enough functioning insulin. There are people who don't make enough GLP. So they eat and their brain really doesn't get the signal that they're full. And I think when you supplement that with these medications, and I'm not saying these medications for everyone by any means, and we don't know the true long-term impacts of these, but I think for some people, supplementing their GLP makes a huge difference for them. And all of a sudden, somebody who was obese and blamed for their obesity can suddenly lose a lot of weight by simply supplementing a hormone. I think that teaches us a lesson a little bit from a physiology standpoint. So I do think these medications are going to make a big difference. They're way too expensive. We have to deal with that. We have to deal with the supply chain, which, by the way, is mostly because of the pens even more than the active ingredients. The pens are what are often in short supply, the thing you inject yourself with. But I think once we deal with those things, I think it'll make a big difference. And I think that will actually, my prediction, potentially put us in better position if we're dealing with another big outbreak or pandemic, because obesity is a huge risk factor. Inflammation, your respiratory system, everything is affected negatively by obesity. And during a pandemic, those things really, really come to the forefront.
This is so fascinating, your documentary. We look forward to it, and we hope that we can bring you back to talk more about it, because definitely the topic of nutrition is extremely, extremely important, and it ties into so many other things. And, I want to now talk a little bit about the topic of enhancing our microbiome. I know that you extensively delve into it. And, it's a personal favorite of mine, because I have been trying to pick food choices at home, with my daughter. For example, yesterday she was wanting to have mac and cheese because she just graduated from her elementary school. And I cut some pickles to go with the mac and cheese. And I told her, Dr. Gupta has written in his book that you got to have some fermented food. So I know pickles are one of your favorite snacks. And, we try to pick food choices, the rainbow, so to speak, and try to have diversity so that we can have a good microbiome. So can you elaborate a little bit more on that, and talk about how we can all, as a community, boost our microbiome, and why is it important?
Well, first of all, you're doing a great job with your daughter. I mean, you teach these habits. I'm a little bit ahead of you in this regard. I have 19, 17, and 15, and all girls, by the way. And it's the best. It's the best part of my life. But I think you got to start these habits early, like you're saying. I'm very interested in the microbiome. We have more bacteria in our body than we have human cells. It's its own entire system that operates within our body and does all sorts of things, from allowing certain nutrients to be absorbed, certain medications to be metabolized. It's really, in many ways, people say it's our second brain, but when it comes to our mood and our emotions, one would argue that it's our first brain. We make more serotonin in our gut than we do in our brain. So, serotonin, which is a neurotransmitter that is often associated with positive mood. It's really important. I think there's two things that have really I've been thinking a lot about with regard to the microbiome. One is that we are at a point now, I think, in medicine, and it's going to continue to grow this way, where we're getting much more personalized in how we can approach patients. So much of what we recommend is based on a study, even a large study, which might be 10,000 people, which is still a minuscule fraction of the human population. And when it comes to the microbiome, our microbiomes are very different. I mean, if you look at someone's microbiome and do a really detailed analysis, I could probably tell you where you live, what zip code specifically you live in. I could probably tell you what kind of diet you have in general. I could tell if you have pets. I can give an idea of what kind of job you have, all by just analyzing your microbiome. It contains that sort of really specific data about us. So it is worth nurturing. And everyone's microbiome is going to be a little different, but I think there are some basic principles that apply. Some of them you mentioned. I think if there is a criteria of the microbiome that is probably the most important in terms of benefit, it is diversity of microbiome. It's not like you want to have a microbiome that is all of this. This is the good stuff, so let me get all of that. Let me just take probiotics, just yogurt, that's it. It's not how it works. You do want a diversity of your microbiome. So the 7 different, the colors of the rainbow ends up being really important. Fermented foods end up being a really good substrate for the microbiome. I came about this sort of on my own because when I'm having writer's block or just having challenges, everyone has had that. You're sitting at your computer and I can't focus. When I eat fermented foods, they just were kind of my superpower. They allowed me to focus. It was very interesting. Someone gave me a bowl of pickles once when I was doing it. I ate it. And then I replicated my experiment on myself, and I started doing it with my family members and friends. And fermented foods are important. The third thing that I would say is that when you're eating a lot of fiber in your diet, people often think of fiber obviously as being very important, but also full of lots of, when fiber is being broken down, waste products that you eventually clear through your gut. those waste products are also very important nutrients for your microbiome. So the fiber seems to have a dual role, really, when it comes to your microbiome. It's not only healthy for your gut, but also providing a substrate for all the bacteria, the good bacteria in your gut as well. So, I think it's really interesting. I mean, there's certain antidepressants that work better for some people versus others. Why? Probably their microbiome. People have fluctuations in their mood, which they think may be related to things in their mind or their brain, probably much more likely related to what's happening in their gut and specifically their microbiome. Even how much you're likely to feel pain. I could take your thumb, bang it with a hammer on a Tuesday, change your microbiome by Wednesday, do the same thing, bang it on a Wednesday, and you could have a totally different pain experience. Why? Because of how I've altered your microbiome. So we're at the early stages of really understanding this, but like you, I'm fascinated by it. I don't know how you feel about it, but there are tests now that home tests even that you can do to evaluate your own microbiome. You may know more about this than I do in terms of the veracity and accuracy of those things, but even if they're not there yet, I think it's pretty clear we're going to get there sometime soon, where people can get this sort of data about themselves.
Absolutely. I'm very excited actually about what is to come next in the world of microbiome, and how we can sort of personalize medicine, with the world of microbiome. And as you know, C. diff, Clostridium difficile, is a bacteria that I've been studying this bacteria all my residency and fellowship and as faculty. And I do research on C. diff, and now we have fecal transplant for patients who have recurrent C. diff, and it works like magic in those patients with recurrence. So definitely there is some important messages that we can learn from microbiome in improving our microbiome. And I think there's more research to come, like you pointed out, especially now that we are also seeing a lot of patients with long COVID. So that is actually a nice segue into my next question that I had for you was, in your book, Keep Sharp, which you wrote before the pandemic. But I think, like I was talking to you backstage, it is even more relevant and more significant now in the current scenario that we are seeing patients with long COVID. Patients are battling with brain fog and other symptoms that they have. What can you elaborate more on the primary principles for maintaining cognitive equity, and how you outlined in your book Keep Sharp? And I know SHARP is an acronym for various aspects, so can you talk a little bit about it?
Yeah, for sure. I think you probably have, depending on what studies you're looking at, 5 to 10% of the population who's had COVID dealing with persistent symptoms lasting at least more than 3 more months after after they're feeling better. For many people, it's much longer than that and never goes away. It is a bit of a general term when you look at something like long COVID, and I think people have defined it besides the time frame in different ways in terms of what the symptoms actually are. And I think that does dictate to some extent how you would best approach that in patients, people who have primarily chronic pain associated with their long COVID. So they developed symptoms that are typically associated with persistent pain. Other people may have brain fog, like you mentioned. There are some basic principles that apply, and there's these long COVID researchers who are trying all sorts of different things. By the way, including even fecal transplants, because they know that simply completely altering the microbiome could have a significant impact on people's symptoms. But I think, there will be entire textbooks written about this new disease class at some place, and probably wards in hospitals where people are primarily treated. But right now, we're still in the early days of this. I will say that, one thing that they've seen that there's a lot of crossover with long COVID are things like social isolation, lack of social engagement, things like that. So making sure people do not become overly isolated when they have long COVID, and having objective data on the value of social connection really goes a long way, I think, for something like long COVID. It's not to dismiss or in any way diminish the impact of all the other potential therapeutics that people are using to try and treat the symptoms of long COVID. But I think in the book, which, as you point out, was written before the pandemic, but focused a lot, not just on Alzheimer's disease, but on the sort of neuro deterioration that people sometimes feel as they get older or even earlier in life. And we found a lot of those same principles apply. Physical activity, we create this special substance in our bodies known as BDNF, brain-derived neurotrophic factor. And you can't inject that, you can't eat it, you have to make it. And so we really approach the book by looking at what are the best ways to actually create BDNF, which is what's going to create more brain cells. It's sort of, as one prominent neuroscientist said to me, it's kind of like the miracle grow for the brain. And they found that activity was really important for that, but not necessarily intense activity. It was interesting, Dr. Chopra, because I've exercised most of my adult life. When you intensely exercise, you make a lot of BDNF, but you also make a lot of cortisol, which is a stress hormone. And what they find is that stress hormone can inhibit the activity of BDNF. So intense activity might be good for your heart, but when it comes to the brain symptoms, sometimes associated with long COVID or something, more moderate activity where you're getting BDNF without cortisol seems to make a big difference. Being socially engaged. And one of the things that really came out about this, and again, I'm not diminishing all the amazing medical therapeutics. I'm talking about the more nuanced points around long COVID. How do you determine the quality of your social engagements? How do you determine that? You probably have a lot of great friends and people you would consider high level social engagers with you. But one of the big things was a question that they would ask among these loneliness researchers, which was, can you be vulnerable around this person? Can you ask this person for help? And the more people you can identify like that in your life, and they were talking about people outside your family. These are friends and acquaintances and people from your social life, but also maybe even your work life. The more people you could identify like that you could ask for help comfortably, probably the higher level of social engagement you had. So long answer, but one of the things I would tell my own mom, who's in her early 80s, living in Florida, I would say, take a brisk walk with a close friend and talk about your problems. That it sounds kind of simple. And again, I'll say it for the third time. It's not to undermine any of the other amazing work that is happening in the field of long COVID therapies. But those things, we have to go back to our basics sometimes. And we know people who are socially engaged have lower reports of pain, lower reports of chronic pain. We know social isolation can cause physical pain. You activate the anterior cingulate cortex in your brain, the same area of the brain that is lit up in people who are dealing with physical pain, that lights up in people who are excluded from the tribe. And so all these things they overlap in big ways, they correlate in big ways. And I think there are fairly simple, straightforward ways to address them.
This is so fascinating. When you talked about your mom and take a walk and talk about your problems, I go to the temple, to the Sikh temple every week. And I see women, older women sitting and gossiping. And I know you talked about gossip in your book as well. And I was just fascinated. I was like, I need to be part of that gossip, because it is going to get me sharper. So, like you said, going back to your basics, so important, going back to your basics.
Yeah, I hope an esteemed doctor like you, that's not the only thing you take away. Sanjay told me that I should gossip more.
Yeah, and we have
It's true.
It is true. I agree. But in the last 2 minutes that we are left with you today, it's been amazing. I just want to ask you one last question, and you can tell us in a brief way about medical journalism. My medical students have been asking me this question about medical journalism, and those who are interested, what advice do you have for them?
Well, I would tell you that I love my job. I've been doing it for almost a quarter century now, and I still love it. And if I didn't, I would have probably left it a long time ago. I will say that I don't think you necessarily need to be a doctor to be a medical journalist. I think it can help. But many of the people that I work with, my producers, we have an incredible team of people. Most of them are not doctors, but they're incredible researchers, and they in many ways could probably get their medical degree by translational property just because they've studied it so much. I think it's going to be increasingly important, the work that medical journalists do in the future. Frankly, I don't think as much of it will be on television anymore. I think television is a disappearing medium, at least cable television is. I think people are going to get their content in this regard from all sorts of different sources going forward in the future. And I think for people who are interested in this, especially young medical students right now, they will probably be at the forefront of a lot of those changes. We were just talking about the microbiome. If I could leave your medical students with one concept just to sort of think about, getting the right information to the right person at the right time is a worthy challenge. I think in many ways, as doctors, we've been trying to do that our whole careers. But I do think as medical journalists, if you look at your job not only as providing information, but also providing a public service to people, then really understanding how to get the right information to the right person at the right time. If I did a documentary about Alzheimer's disease a few weeks ago, for 30% of our audience roughly, they really did not have any relationship to the topic. They did not have Alzheimer's. They don't know anybody who has Alzheimer's. Probably about 30% or 20%, call it, have a interest in it, just out of curiosity. For about half the audience, it may have been the most important documentary they watch all year. But we don't always know who is who. And we would love to get that sort of content to somebody right at the time that they need to hear it because they're dealing with something in their own lives. And now I need to know. So using technology, continuing to gather, just be a curious person about the world. If you're a curious person about the world, then being an investigative journalist is the best job in the world, I think. If you have those attributes, then I think it's a great thing to do. And obviously, you don't need to be a doctor to do it, but you can be, like I've done it. And I think in many ways you're a more informed journalist as a result of your medical training. Right now, I would say write as much as you can. Write for, if Dr. Chopra here, she has her newsletters and her various publications. Write for them, because it'll force you to go through the process of tackling a topic and presenting it in a way that a large number of people can understand it. You'll do this eventually, I'm sure, Dr. Chopra, with your daughter, but I practice all of my messaging on my own kids ahead of time. Is it something that teenagers can understand? A lot of times you can get too up in the clouds, and it's very important, but look, nobody understands it. It's not going to leave an impact. So understand how to present things in a way that'll leave an impact. And a lot of times that also means shortening your message. One of my favorite quotes is from Mark Twain. He said, "I would have written you a shorter letter, but I didn't have the time." Point being that it takes work to make your message as concise as possible. Still effective, but as concise as possible. No wasted words.
That is so great. Today we've talked about vaccines, we've talked about reemerging infections, we've talked about microbiome, about nutrition, about staying present, about staying relevant, about medical journalism. This has been amazing. Sanjay, we really appreciate your time. And we hope.
Let me just compliment you as well. I appreciate this very much. And I'm not just saying this because you're here. You're a very good interviewer. A lot of people, they have their questions, and I appreciate that. And then they go from question to question to question. For you, you're telling a story here. That's what interviews do. You're created a narrative around this, and I really appreciate it. You're very good at what you do. So thank you.
Thank you, Sanjay. And I hope I can convince Padma Aunty to bring you back to us. And good luck to you for your future documentaries. And I look forward to reading more books. I'm enjoying every single book that you've written. And thank you for this opportunity to us. And again, have a great day. Thank you.
My honor. My pleasure. Thank you for having me.
Thank you.